Welcome to this Infinitec presentation, BloodBorne Pathogens. Special thanks to Blue Valley Unified School District 229 for contributions to this important presentation. Whether in the classroom, on a playing field, or on a school bus, all school employees must know the potential danger of blood-borne pathogens. Job classifications in school that are often at increased risk for contracting blood-borne pathogens include custodians, school nurses, job coaches, OTs and PTs, special education teachers, early childhood teachers, and paraprofessionals. Under the OSHA, Occupational Safety and Health Administration regulations, the Bloodborne Pathogen Standard, and the Bloodborne Pathogens Compliance Directive require employers to identify the jobs, tasks, and activities that could expose employees to potentially infectious bodily fluids. The objective of this presentation is to provide you with greater knowledge of what are bloodborne pathogens, what are potentially infectious bodily fluids, how to protect yourself, and how blood and bodily fluids should be cleaned up. The potential for occupational exposure to bloodborne pathogens such as hepatitis B virus, hepatitis C virus, and human immunodeficiency virus is always present. Blood is the #1 source of these viruses in the workplace. Your risk of contracting one of these viruses at school is low because your contact with blood is infrequent. However, when the need arises, you must be prepared to deal with blood and bodily fluids safely. So what are bloodborne pathogens? According to OSHA, bloodborne pathogens are microorganisms in human blood that can cause disease in humans. The three most common are the hepatitis B virus, HBV, the hepatitis C virus, HCV, and the human immunodeficiency virus, HIV. Unfortunately, children are as prone to bloodborne diseases as adults. That means you're as much in danger of infection from the children you work with as any other group in society. The term hepatitis means inflammation of the liver. The hepatitis B virus poses greater risk to you at school than either the hepatitis C virus, HCV, or HIV, since it's more easily transmitted. The hepatitis B virus can survive for at least 1 week in dried blood on environmental surfaces such as desks, work tables, tools, broken glass, metal, doorknobs, computer keyboards, toys, and other surfaces. Environmental contamination is often responsible for the transmission of hepatitis B. This is the primary reason for the importance of properly cleaning and disinfecting any blood-contaminated surfaces. A vaccination for the hepatitis B virus has been available since 1982. The vaccine prevents hepatitis B disease and its serious consequences, and has been shown to be safe when given to infants, children, and adults. Currently, there is no vaccine for the hepatitis C virus. The hepatitis C virus, at room temperature, on normal surfaces, can survive outside the human body for at least 16 hours. 70% of hepatitis C infected persons will suffer from chronic liver disease. The hepatitis C virus is the leading cause of liver cancer and liver transplantation. It's important to understand the seriousness of the hepatitis C virus, but it's also important to realize that HCV is not spread by casual contact. Thus, shaking hands, kissing, or hugging are not behaviors that increase the risk of transmission. Unfortunately, we're also very aware there is currently no vaccine for HIV. The human immunodeficiency virus is the virus that leads to acquired immunodeficiency syndrome, or AIDS. A person can carry HIV for many years and not have any symptoms until it becomes AIDS. AIDS attacks the person's immune system, which makes it difficult for the body to fight off common diseases. When HIV-infected human blood or other bodily fluid is dried, the risk of environmental transmission is essentially reduced to zero because the virus does not survive outside the body. HIV has been found in very low quantities in the saliva and tears of some AIDS patients. HIV has not been found in the sweat of an HIV-infected person. Contact with saliva, tears, or sweat has never been shown to result in the transmission of HIV. Although exposure to blood-borne pathogens in a school environment is very limited, it's important to identify the risks and take the proper safety precautions. In general, the only time that any employee is exposed to blood-borne pathogens is when a student or coworker suffers an injury that bleeds, or there's an illness causing exposure to bodily fluids with visible blood. You could be exposed to blood-borne pathogens at the time of an injury if blood or bodily fluid splashes onto you. When administering first aid treatments, such as applying pressure to a wound, wrapping an injury, providing CPR, etc. If a work surface, such as a table, chair, or computer keyboard, is not cleaned or decontaminated immediately after an incident. You could also be exposed by cutting yourself with a contaminated sharp object like broken glass, sharp metal, a needle, a knife, or the exposed end of an orthodontic wire. Or if your job description or task includes cleanup after illness or injury. Employees working with students with special needs and/or medically fragile students should take extra caution. These students may be more vulnerable to injury, likely to have special medical needs such as feeding tubes, and/or be dependent on adults for personal care such as eating or toileting. It's important to remember that you cannot become infected with HBV, HCV, or HIV through casual contact, drinking from a water fountain, or a cough or a sneeze. How are blood-borne pathogens transmitted? Blood-borne pathogens can enter your bloodstream through a cut in the skin, abrasions or scratches on the skin, dermatitis or other skin rashes, even hangnails. The best way to prevent this from happening is to cover any open skin with a bandage while you're at work. Blood-borne pathogens can also be transmitted through mucous membranes, such as infectious material entering the eyes, nose, or mouth. Understanding that blood-borne means carried in the blood, there are other types of bodily fluids that can contain potentially infected blood. These include saliva, vomit, urine, semen, vaginal secretions, or cerebrospinal fluids. It's important to treat all blood and bodily fluids as if they contain blood-borne pathogens. With that awareness in mind, the concept of universal precautions was established. Universal precaution number 1 is diligent and proper hand washing as a key to infection control. Hands should be washed immediately before and after physical contact with a student when providing first aid, diaper changes, assistance with feeding, or assistance with toileting. Hands should be washed immediately after contact with blood or bodily fluids and/or garments or objects soiled with blood or bodily fluids. Hands should be washed immediately after contact with used equipment such as stethoscope, emesis basin, or feeding tubes. Good hand washing keeps contamination from transferring from your hands to other parts of your body or to other surfaces you may come in contact with later. You should wash your hands with non-abrasive soap and running water for at least 20 seconds. When hand-washing facilities are not available, such as on the school bus, substitute an antiseptic hand cleanser or antiseptic towelettes. Use these as a temporary measure only. You must still wash your hands with soap and running water as soon as you can. Another universal precaution includes avoiding contact with all potentially contaminated blood or bodily fluids through the use of protective barriers or PPE, personal protective equipment such as protective clothing, safety glasses, and latex or vinyl gloves. Gloves must be worn for all scenarios involving blood or bodily fluids. Staff members must wear gloves when applying bandages or putting pressure on a wound. Gloves must also be worn for any cleanup procedures of potentially infectious materials. If an emergency arises on the playground or in the hallway, and there is no time to find or put on proper protective equipment, you can create an impromptu barrier from blood or bodily fluids by using a piece of plastic, a clean garbage bag, paper, your shirt, or other items. And again, hands should be washed immediately after removing PPE such as gloves or clothing.
Turn on the water, wet your hands, apply a good amount of soap and lather up, and then focus on washing your hands for about 20 seconds, about the time it takes to sing Happy Birthday twice. Focus on washing the front of your hands, the back, in between the fingers, around the nails, and so on. And then rinse everything off. Use something to wipe your hands after that, preferably something disposable like a paper towel, and then use that to turn off the tap as well. If you get a chance, use that to also open the door to the bathroom as you're leaving.
If accidental exposure occurs, immediately wash the skin thoroughly with soap and water. If broken skin or mucous membranes are contaminated, then you should notify a supervisor or appropriate personnel immediately, document the event, and follow your district's procedures in a blood-borne pathogen exposure control plan. When dealing with blood-borne pathogens or potentially infectious bodily fluids, remember to follow the blood-borne pathogen standard precautions to enable you to respond to a situation without fear of infection. Remember to check personal protective equipment for damage before putting it on. Remember to remove PPE carefully to prevent the spread of contamination. Remember to wash thoroughly with soap and water after removing personal protective equipment, as well as any exposed skin. Remember to flush exposed eyes, nose, or mouth quickly and thoroughly with water. Remember to minimize splashing or spattering of potentially infectious materials. Remember to cover open cuts, rashes, and other broken skin. Remember to dispose of used needles carefully and immediately in assigned puncture-resistant, leak-proof containers identified by the biohazard symbol. Remember to follow cleanup procedures as instructed by your school or supervisor. Remember to clean and decontaminate pails and other reusable containers immediately after contact with potentially infectious materials. Remember to report any on-the-job exposure to blood or other bodily fluids promptly and get medical attention. Remember to place contaminated PPE, towels, etc. in closable, leak-proof containers or bags for disposal or decontamination. Let's protect ourselves by not worrying that casual contact with an infected person will transmit a blood-borne disease. Not letting fear of exposure to blood-borne pathogens keep you from helping an injured person. Not mixing contaminated clothing or linens with other laundry. Not eating, drinking, smoking, applying makeup, applying lip balm, or handling contact lenses in areas with exposure potential. Also remember, don't touch any surfaces, clothing, equipment, needles, or other sharps that may be contaminated by blood without appropriate personal protective equipment. Don't bend, recap, or remove sharps unless specifically instructed to do so. Don't ever reach by hand into a container holding sharps. Don't clean up broken glass by hand. Use tongs, a brush and pan, etc. And we're required to add, don't practice unsafe sex, inject illicit drugs, or share needles. In summary, report any exposure incidents to your supervisor immediately. Complete the forms required to properly report an exposure incident, and make arrangements for physician assessment and treatment. This concludes our Infinitec presentation, BloodBorne Pathogens, with special thanks to Blue Valley Unified School District 229 for their contributions to this presentation. Downloadable documents related to this presentation have been included in the attachments section, available by clicking the paperclip icon in the lower right. A corresponding quiz has been paired with this presentation, available through the link on the presentation description page.